problem, associated problems.
Okay, so let's suppose we have two children. One is of 2 years, like he's 18 months old, and one child who is 11-year-old. So what is the screening test for the celiac disease for both these patients?
Ma'am, for 18 months, it is tissue transglutaminase, TTGs.
Okay, so for both, it's anti-tissue transglutaminase.
Yes, ma'am.
Okay.
No.
Hmm. Okay. What is the percentage of the type 1 diabetes mellitus who do have the celiac disease? It is just for your preparation for the viva. That is, viva usually इतना मुश्किल नहीं होता. They usually stick to your patient. What you have told, they will just ask why you have told this thing to me. ये मैं आपको इसलिए करा दी कि चले थोड़ी सी आपकी जो है उसकी तैयारी हो जाए. Okay. Okay. So what is the percentage of the type 1 diabetic patients who do have the celiac disease?
7 to 8%.
7 to okay. What is the percentage of the type 1 diabetes who do have this hypothyroidism? These questions may be asked in your FCPS exam. Usually ये question बनता नहीं है, but ये पूछा जा सकता है. It's about 6% those who have the celiac, and 3% of the patients they will have this hypothyroidism. They may have hypo, they may have hyper, but there is more association with the hypothyroidism. Okay, so what is insulin sensitivity factor?
Ma'am, insulin sensitivity factor when it is used for to measure the insulin unit when patient wants to take any uh, sweet food.
What is insulin sensitivity factor?
Ma'am, it is done with one formula.
Formula छोड़ो. What is the basic concept, beta? What is insulin sensitivity factor?
मैम इसका बेसिक कॉन्सेप्ट यही है कि अगर पेशेंट किसी पार्टी में या बच्चा कुछ चीज खाना चाहता है जो कि हाई इन ग्लाइसीमिक हो, कार्बोहाइड्रेट हो, तो उसके लिए हमने इंसुलिन के यूनिट कितने उसको दे सकते हैं कि वो उसको कंट्रोल कर ले.
And what is the insulin carbohydrate ratio?
मैम इससे हम कार्बोहाइड्रेट को कितने ग्राम को हम कम कर सकते हैं
किससे?
इंसुलिन के यूनिट से.
ओके, चलो अब दोनों के ऊपर जरा आपने कंसंट्रेट करना. व्हाट इज इंसुलिन सेंसिटिविटी फैक्टर एंड व्हाट इज इंसुलिन कार्बोहाइड्रेट रेशियो? ठीक है, आप खुद बेटा दोबारा से बताओ. इंसुलिन कार्बोहाइड्रेट रेशियो क्या है?
इंसुलिन कार्बोहाइड्रेट रेशियो है कि शुगर इतने यूनिट इतनी शुगर कम कर सकते हैं.
हाँ जी, शाबाश. So I'm taking this much amount of this meal that is having this much amount of the carbohydrate. So 1 unit of insulin will be used to decrease how much carbohydrate.
यस मैम.
ठीक है. इंसुलिन सेंसिटिविटी फैक्टर क्या है?
कि कितनी यूनिट देंगे तो कितनी शुगर कम होगी.
हाँ, ठीक है, समझ आ रही है.
यस
ओके
मैम.
ओके.
एक में कार्बोहाइड्रेट.
ठीक है. Now you told me when I asked you what is the insulin sensitivity factor, you told me when the patient is going to any party, then how much insulin he is going to take. इसका एक सिंपल सा कॉन्सेप्ट रखे ना. इंसुलिन सेंसिटिविटी फैक्टर, 1 यूनिट ऑफ इंसुलिन में कितनी आपकी ग्लूकोज को कम करना है. So this याद करने के this insulin sensitivity factor, this is to do with my blood sugar. Okay, ये मैंने इंसुलिन दिया जिससे मेरी कितनी ब्लड शुगर को कम किया है. This is insulin carbohydrate ratio. So this much gram of the carbohydrate that is present in any meal, and 1 unit of insulin will reduce this much amount of the carbohydrate. So इसको memorize करने के लिए ये जो insulin carbohydrate ratio है, that is the amount of the insulin unit, but the carbohydrates which are present in the meal. ठीक है. and this is the amount of the insulin that is going to use for the blood sugar that is present in my blood.
Blood.
ठीक हो गया? Okay. So you must know what is the insulin sensitivity factor. उनकी definitions आपको याद होनी चाहिए. In the exam they may ask you about this. Okay. So does your patient ever suffered from the honeymoon period?
No, ma'am. There is no transient phase.
Okay. How did you ask for that?
मैंने like I asked कि जब शुगर डायग्नोज हुई थी, कभी ऐसा हुआ था कि शुगर बिल्कुल खत्म हो गई हो, आपने दवाइयाँ शुरू की और तो वो उसकी शुरू से ही हाइपरग्लाइसीमिया ही रहा है,
Okay.
अनकंट्रोल्ड।
Okay. So anytime blood sugar level that, oh sorry, this insulin units they were decreased or not? कभी इसकी इंसुलिन की यूनिट की उसमें चेंज हुआ था या नहीं हुआ था?
मैम कभी भी नहीं, पहले जो डायग्नोसिस पे इसके 5 यूनिट्स थे लॉन्ग एक्टिंग और उसके अलावा प्री मील उसके 7 थे, अब उसके वो ज्यादा हो गए हैं।
Okay. How many times your patient suffered from the decay since
2
he is
टाइम,
diagnosed? So 2 times.
previously and third time this time.
Okay. So the total that is 3 times.
Yes, ma'am.
Okay. Every time the reason is what?
Poor compliant. He is taking food, dietary
Okay.
food.
Okay.
Ma'am,
So
mother is also not concerned about the disease and its complication and its compliance.
okay. So what is the reason for that? Why mother is
Ma'am,
not?
uh, uh, because ma'am, father is live in Dubai and she is the only present in home
Caretaker.
and
Okay.
has low IQ level as well.
Okay.
So she
How many times
not
she is going to check the sugar of his patient, of his child?
usually 2 to 3 times per day when symptoms present. Otherwise, no proper checkup.
Okay. Anytime since he's diagnosed, he checked the blood sugar level at 2 a.m., 2 or
Yes, ma'am.
3
There
a.m.
is the Tomogoy phenomena present.
The
Two to
Somagoy phenomena was present. So,
present. There is midnight hypoglycemia at 2 or 3 a.m.
okay. So, was any change in the in the insulin regime was made in your patient?
Ma'am, she don't have any knowledge about the
Okay.
decrease or increase
Which type
insulin
of the
dose.
insulin she is giving to your to the patient?
Ma'am, he is taking long acting and ultra short acting insulin
Okay,
in the pen form.
in the pen form. So, is she taking any Lentis or Glargine?
Ma'am, Glargine and Aspart.
She's taking Glargine and Aspart?
Novorapid, I think.
I think, okay. Now see the
Aspart,
point.
Novorapid, and Glargine ultra short acting.
All right. Okay, can you predict the diabetes mellitus? Can you predict the diabetes mellitus?
On which basis? Sorry, I
Can
could
you
not understand.
predict diabetes mellitus in any patient? यही कहती है कि क्या मेरे दूसरे बच्चे को भी डायबिटीज हो सकता है?
Yes,
How will
ma'am.
you counsel her?
Association. There is association with the. There is association in the family. If there is a present in the family,
So,
a father has, a mother has, but I don't know about the values of the.
okay.
Could not
What do you
recall
know
the.
about the insulin antibodies?
Ma'am, there is insulin islet cell antibodies, insulin glutamic, is GADA, and or
Okay. What is metabolic memory?
it is metabolic.
What is metabolic memory? Okay.
Metabolic memory.
डायबिटीज में क्या होती है मेटाबॉलिक मेमोरी?
हम ऑटो एंटीबॉडीज जो अटैक करते हैं।
ओके, अच्छा जी. What is the significance of the HbA1c?
Ma'am, it tells about the previous 3 month record of blood sugar level.
Okay. Can you have false positive or false high levels of HbA1c?
Yes, ma'am, it can be.
In which conditions?
Um,
What are the
Ma'am,
reasons of the false low level of HbA1c?
false low levels.
Yeah.
Low levels. Uh, any kidney condition. But
Sorry बेटे,
I'm sorry.
चलो ठीक है, चलो ठीक है। कुछ और राबिया आपने पूछना हो? Let us stop it.
मैडम मुझे ना इस